You recently wrote on social media that our country owes a great debt to those who have served in our armed forces. Unfortunately, the Trump administration is turning its back on our veterans by stripping away essential resources from the VA. What are you seeing specifically in your district, and what needs to be done to counteract these measures?
So I don't think we've seen the final shoe drop on this. So there has been the beginning indications of, I think, what will be a pretty massive loss of jobs. And remember that many of the jobs who serve veterans are held by veterans. So it's estimated that about 1 in 4 people who hold a job with the VA are veterans themselves. Let's assume that those cuts that we're hearing that are coming, 80,000 or so people will come. They will come right out of the opportunities for good health and good lives that my veterans in Coatesville experience. I have a VA hospital right in Coatesville that is one of the nation's oldest, actually. And what we've already seen, even before this final shoe drops, is we've already seen some degradation in care. And let me give you some specifics. Some people have been asked who are in the mental health space to return to office. What does that mean? They return to offices that can't accommodate them. In spaces that are too small for all of them. These are mental health professionals, and they are now being told that they have to return to their office, to an office, where they're sitting in banks of phones, where they're providing mental health counseling to veterans, sometimes by phone, sometimes as we're speaking, to one another. And the idea that a veteran will consider his or her case secure and private when there's a phone bank of people who are sitting on card tables in some cases, processing calls is it's false. I can firsthand say that it's really important that people feel as though when they call in or they dial in that they have a private conversation with somebody. And so these consequences of return to work with no thought to where work is insane, especially in the mental health space.
What will it take to give those workers enough space or provide the resources that the VA needs, in your opinion?
Well, this gets back to kind of the beginning of our conversation with these young students from Afghanistan. Why are we making these kinds of choices in such a haphazard kind of a methodology? Why are we having a conversation after the fact about unwinding a decision that was made rather than making a deliberate decision and thinking, hard about it? And that's been the case with the VA as well. Only, it's really easy, I think, for Americans to kind of think, well, those are 100, women far away getting an education from a country that isn't the United States. We don't need to worry about that. But you can bet the minute that our veterans are being affected, there will be all kinds of people crying out for, change. And that's why I really just want to prevent that from happening to begin with. Why is this an okay process that we're going through? It's absolutely an untenable process. And as I mentioned, this is what our jobs are here in Congress. My job on the Armed Services Committee is to go through a very painful appropriations process and a painful approval process of what our budget will look like for the military every year and where the money's going to go for the military every year. There's the same conversation that happens for the VA every year. And so we have to be able to have our government work. And that doesn't mean that we have people coming kind of swooping in from the outside, telling us what we got wrong. And I think this is why I understand the American people and their American people's anxiety. People approach me and say things like, well, I just don't understand. This is okay. We're just putting a pause on it for 90 days. We're just taking a look at what's, happening and how we're spending things. And if that were true, I would understand that. But that's not indeed what's been happening. These are programs that in many cases have taken years. This is the third time that mathematical and statistical modeling bill that just passed today has passed in the House. And so hopefully this year it'll be the first time it passes in the Senate and it'll become a law. And so this is not, some sort of overnight process where we can just undo all of the work that we've done. And I think that's one of the things I'm most worried about, particularly with our vets.